my 2-week post-op bunion surgery. So after that cast incident I had with my first cast, it definitely did get better. After my 7th day after surgery, I stopped elevating my foot. I mean, not because they told me I can stop. I just can't do it. I just can't sit on my ass all day. That first week was crucial. I did. And I started feeling better the 7th day, so I started getting more active day by day, day by day. And I would try to elevate my foot, but not really. And then eventually I just stopped elevating my foot altogether. Just don't have time for it. I mean, I have 2 kids. What do you expect? So they do recommend elevate your foot as much as possible for the 2 weeks. Okay, it doesn't hurt. The swelling is not getting any worse. It's just normal. I mean, it doesn't get, the swelling, my swelling did go down a lot that first week. And ever since then, it's just stayed steady, I think. I mean, I don't know. It looks normal to me. The swelling. So on my 2-week post-op doctor visit, I asked them about the swelling. So when I do go to sleep, I do elevate my foot. Every time I go to bed, I elevate my foot. When I wake up, the swelling is down, like completely down to the point where my toes look like raisins. They like shrivel up. But 2 minutes after I stand up and start moving around in my scooter, the swelling is back to normal, just back the way it was before I went to bed. So I asked the doctor, so what's the point of elevating your foot if it just swells right back up the minute you stand up? She was like, oh, well, you're going to have the swelling regardless because there's so many little vessels in your toes. So the swelling, you're going to have swelling for a while, on and off. It'll look better some days, and some days it'll look worse, depending on what stage you are. So I'm like, okay, on the healing process. So I'm like, okay, whatever. It's not bothering me. I don't elevate my foot until I go to sleep. So it's working for me. Everybody's different. I don't have a lot of incisions. I just have one large one that goes down from my toe down to like my foot, half of my foot. It's about 3 inches long, I say. I don't know. I mean, it's not bad. So far, that's what's going on. My 2nd week, I'm active doing my regular stuff. I'm on my scooter all the time, all day, here and there. I mean, I don't sit around much. I just can't with 2 kids. So the only bad thing is I have the cast on. I can't walk on it, and I'm using a scooter. And I have 2 kids that I have to juggle around here and there. But it works. I started driving 7 days after my surgery. I'm fine with driving. I don't go anywhere far. I just run some errands here and there. Maybe 2 hours max. And my next appointment is in 3 weeks. And they say in that 3 weeks, they will take off the cast and I will have a boot on. For how long? I don't know because I forgot to ask. But I guess I'll find out in 3 weeks. And I'll show you my toes. I don't elevate, so you can see how my toes look now, how swollen they are. They're not bad. bad. I say it's average. And I can move them around. I can move my toes. Not, it doesn't hurt when I move my toes. So I asked the doctor, am I supposed to be moving my toes? She didn't really give me a straight answer. I mean, I can move them. So I do that every so often. Just to, I don't know, just to do it. Make sure I don't stiffen up. And I want my toes to have some mobility, even though they didn't tell me you should be moving your toes. You shouldn't be. They didn't. I mean, you have to ask all the questions because they don't tell you shit unless you ask them. And then she didn't really give me a straight answer, so I'm like, okay, whatever. I can move them around. I'm moving them around. It doesn't hurt. As long as it doesn't hurt, I guess it's fine. So I will be checking in 3 weeks and see how it goes because, I mean, I'm active. I'm doing whatever I need to do. Don't elevate my foot. I do it at night. And I don't ice. I have not iced, not once, because one of the doctors told me, what's the point? You can't ice right on your foot. So you icing behind your knee is not going to help much. So I never iced. I didn't ice my foot. There was nowhere to ice. I always had something on my foot. So anyway, I will check in 3 weeks and see how I am. Hopefully just the swelling just gets better. I'm not on my foot. I don't use my foot at all. So that's a plus, I guess. That's why my swelling just stays steady, average. Maybe it's getting better and I don't notice. I don't know. But it doesn't hurt. I'm always on my scooter. Never stand on my left foot. Never do. When they tell me I should start trying to use it, then I'll start using it. Maybe not even then. Maybe I'll wait a couple days more and then try to use it. I have my scooter. It gets me around. That's my other leg. I have no reason to put my foot down on the floor because that's where they say you will get really horrible swelling if you try to use your foot too soon, which I will not do because I'm happy the way I feel now. And I will use it when they say try at short and use it. As they say, I think they say just use it in short periods of time until you gradually move up to frequently and be more active. I don't know. We'll see. But I will check in 3 weeks. Bye.